As we wrap up, we are now going to look at some of the implications near the end of the pregnancy. Let's take a quick look at the spine and optimal fetal positioning, or OFP. Optimal fetal positioning is the way the baby needs to be positioned for the best birth route. Before birth, the baby is best positioned with its spine along the front of mama's belly, looking towards her spine. It is normal during pregnancy for mama to have an increased lordosis in her lumbar spine. There's no need to fix this by tucking in her tailbone. Rather, encourage a nice anterior tilt in the pelvis. Keep the baby forward, so no slouching. The posterior pelvic tilt, mamas, this brings the weight of the baby onto the spine and closes off the pelvic floor. It will feel good to be in poses such as cat-cow, where the belly can be off the spine and off the pelvis. In the third trimester, it's good to keep the anterior tilt. Baby will eventually turn its head down, so it is looking at her spine with its spine against mom's belly in preparation for birth. Forward leans, shoulders in front of the hips. Squatting and, at the very least, keeping upright, so no slouching or posterior pelvic tilt, is all good postural positioning that helps baby move into OFP. From the time that baby comes into the position in the third trimester, abstain from all inversions, even downward dog, to keep things ready to go and baby in a good place. While we want to tone and have tone strong mamas, we also want moms who can tune in and relax the pelvic floor. We want to encourage them to refrain from excessive mullibandos and have balance the strength of the pelvic floor with an ability to release and soften the pelvic floor. Which position of the lower back do we prefer for OFP? Keeping in mind that this is a generalization. Which lower back position is more conducive to optimal fetal positioning? The one on the right, lordotic, anterior rather than flattened or tucked in. Try it out. When you sit on the edge of a seat or the bolster or the bossy ball or the edge of the bed and you tilt your pelvis, you can really feel the positioning happening and more of an opening for your pelvis there. When we look at hot or heated yoga, sweating is fine and normal, but we don't want mama's core temperature to increase too much. That has also been linked to birth defects. So unless you're a veteran, stay away from hot yoga. Hot yoga puts too much stress on the body's systems to maintain homeostasis, especially when mamas already have low blood pressure. Hot yoga causes more dilation of the blood vessels, which can lower blood pressure and cause dizziness. Understanding the hormonal cardiovascular and physical changes will give you a platform that will help you create common sense modifications for your practitioners. Be creative and be sensible and empower your students to listen to their body. What an amazing opportunity to help mama facilitate her experience. Let's talk a little bit about communication in pregnancy. How should you greet your prenatal students and what are best practices? So, as a goal, we want to empower them to feel confident and connect with their bodies. We want to welcome all prenatal students with open arms and encourage them to trust their bodies. We want to empower them to trust their bodies and find out if they're new or they're seasoned practitioners. If they're new to practicing while pregnant, give some common sense guidelines and encourage them to trust their own experience. Every pregnancy is different and they will know best. So, what are some good general rules of thumb for your prenatal students? As a general rule, seasoned practitioners may continue their practice using their own discretion. New students should refrain from the more complex poses such as advanced back bends and inversions. If you are part of the 200-hour yoga teacher training certification program, there is a activity, which is a partner activity of script and role play that you will find in the Google Classroom. I encourage you to look at that, to role play, and record yourself as you and then upload that video for marking. That comes to the conclusion of Intro to Prenatal. If you're in the current 200-hour yoga teacher training certification program, you will find some student review questions and information where you will find your assignments that you can complete and upload to the Google Classroom. Thank you so much.